Hello, nice to meet you. I am the educator on sexual abuse prevention and treatment issues.
Hi, it is a pleasure to meet you as well. I am a supportive parent and would like to be cautious of my child's behavior. What types of issues will you be discussing with me today?
I will go over the basis of what sexual abuse is, including the terminology we use. We want to focus on the effects of child abuse, including physical and sexual abuse underlying child-adolescent behaviors. The more abuse a child experiences physically and/or sexually, the more likely they are going to exhibit behavioral problems such as drinking, drug abuse, and possibly suicidal ideation.
Can you explain to me what sexual abuse refers to?
Sexual abuse can be expressed in a variety of terms, including child sexual assault and child molestation. Both terms mean taking advantage of a child to meet the sexual needs of an adult or a perpetrator. The many sexual behaviors that are enacted can vary from non-touching offenses, to fondling, to sexual intercourse. However, the most common among those behaviors is fondling, which does involve physical contact to the genital area. The less likely common behavior is actual intercourse between the victim and its perpetrator.
Statistically, what would you say the percentage actual and attempted intercourse would be?
In one study of sexual abuse, actual and attempted intercourse accounted for 2 and 8 respectively of incidents reported by children, and 9 and 10 respectively of incidents reported by parents Hudson, Diane, and Patsy Skeen. Child sexual abuse. Family relations 215.
What are some effects and characteristics that an abused child displays?
Many incest victims suffer physical trauma. However, the physiological damage experienced by a child is far worse. In a recent study, psychologists have explored the relationship between sexual abuse history and problem outcomes in adolescence and examined factors that increased or decreased the likelihood that victims of sexual abuse will engage in alcohol abuse and experience suicidal thoughts. The result of sexual abuse is connected to many problematic behaviors, such as engaging in self-destructing coping behaviors. These behaviors are directly related to the actual experience of sexual abuse, the length of abuse, the use of force, and the relationship with the perpetrator. Milner, Joel, and William Murphy. Assessment of child physical and sexual abuse offenders. Family Relations 478-479.
What are the different factors or variables that cause the affected child to produce these negative symptoms?
The moderating variables are categorized into 3 parts: high history of physical abuse or no history of physical abuse, supportive parents versus non-supportive parents, and high parental monitoring versus low parental monitoring. It is believed that victims of sexual abuse have fewer symptoms when parents are more supportive, and are shown to have more problems if the family is dysfunctional. Parental support is believed to decrease the likelihood of children suffering from depression and believing that life is not worth living. Children who are strictly monitored engage in fewer risk-taking behaviors. Also, victims of sexual abuse were less likely to live with 2 biological or adoptive parents than in other family structures. Luster, Tom and Stephen A. Small. Sexual Abuse History and Problems in Adolescence. Journal of Teach and Marriage and Family 133.
How can I detect such symptoms as you described in my child?
Generally, any change in a child's normal behavior can be a result from sexual abuse. Physical signs can include irritation, pain, and/or injury to the genital areas, pregnancy and sexually transmitted diseases. Behavioral indications can include sleep disturbances, regressive behavior, depression, lack of trust with friends and family. Hudson, Diane, and Patsy Skeen. Child sexual abuse. Family Relations 217.
What are some prevention strategies?
There are 10 simple strategies that both parents and the child can benefit learning from. 1. Give children the correct terminology for the sexual parts on their body. 2. Help the child identify different types of touching, what is appropriate to touch and what is not appropriate. 3. Teach children that their bodies are their own private property. 4. Teach children that abuse is not their fault. 5. Teach children how someone might try to manipulate them into an abusive situation. 6. Encourage open communication with your child. 7. Believing and supporting your child. 8. Foster appropriate attitudes and responsible adults. 9. Teach and encourage the child to tell someone if they have a problem. And lastly, 10. Make resources for the child available. Hudson, Diane, and Patsy Skeen. Child Sexual Abuse. Family Relations 218.
Thank you so much for your time. You have really been a major source in informing me how to prevent and lessen the effects of child sexual abuse.